Hello everyone, welcome to our HIV intervention video. In this short video, we will analyze the HIV complex system by using systematic approaches, including net logo, causal loop diagram, behavioral effects, and design thinking. Moreover, an intervention will be introduced based on the analysis results. According to the World Health Organization, the human immunodeficiency virus is a virus that targets the human's immune system and weakens defense systems. It can be transmitted via the exchange of a variety of bodily fluids from the infected individuals, such as blood, breast milk, semen, and vaginal secretions. It has become a major global public health issue and has claimed more than 35 million lives since this virus was discovered in 1981. We created a causal loop diagram to show that HIV can be influenced by multiple factors, including social influences, education, biology, individual influences, government, and the economy. Before designing an intervention, it is important to understand the interrelationship between these elements. The incidence of HIV directly affects the allocation percentage of medical resources, which in turn affects government policies. Increase of such policies will likely promote medical research and education in the area, thereby reducing the incidence of HIV and ensuring social stability and rapid economic development. Although it is difficult to intervene from the government level, there are still many alternative approaches. For example, promoting condom use and free testing in universities. However, if people lack basic knowledge and are unaware of the hazards of HIV, they might not use these products at all. Developing new drugs against HIV is also an alternative option, but it is also difficult to make an impact due to our insufficient funding and superficial medical knowledge. Therefore, the education sector is a relatively accessible area for our intervention implementation. Specifically in the education sector, an education program will increase the awareness of students, parents, teachers, and friends, and thus positively affect their behaviors, sexual or otherwise, and thus reduce the incidence of HIV in the general public. In addition, there are many reinforcing loops which indicates that by implementing the intervention in this sector, we will be very likely to get affirmative results. To further explore the possible factors affecting the spread of HIV, we used net logo HIV model. The 5 elements in the model are the initial number of people, the average coupling tendency, the average commitment, average condom use, and the average test frequency. From net logo, we mainly had 2 discoveries that are related to personal lifestyle and awareness. First, we compared average condom use values between 0 and 10, and the results suggested that using a condom can significantly prevent HIV. Second, we compared the average commitment value between 37 weeks and 149 weeks, and the result suggested that maintaining a long-term relationship can help prevent getting infected by HIV due to fewer sexual partners. These findings indicate that these topics are essential in an educational intervention to develop sexual awareness and change sexual habits. Research was done in mid-income countries and demonstrated that school-based sex education is an effective strategy for reducing HIV-related risk. Students who received school-based sex education interventions had significantly greater HIV knowledge, self-efficacy related to refusing sex or condom use, fewer sexual partners, and less initiation of first sex during follow-up. During our research, we found out that the HIV situation in China is not very optimistic, even though the national prevalence is low. In 2018, the Chinese Center of Disease Control and Prevention released a report revealing that the number of domestic HIV cases had jumped from 719,000 in 2012 to 1.2 million. One of the groups most at risk of contracting HIV is students. From 2011 to 2015, the number of 16 to 25-year-olds diagnosed with HIV grew by 35%. Therefore, providing more targeted prevention programs for high school students has become an increasing challenge in China. Although in early 2017, a new sex education curriculum had been introduced in China, HIV education is still lacking in such curriculums. Our intervention is the HIV educational cartoon application HIVe, accompanied by a seminar run in school. We have collaborated with non-government organizations such as AVERT and China AIDS Fund for assistance in funding and implementation. Designing this application requires a multidisciplinary team including HIV specialists, psychologists, software engineers, graphic designers, and more. It contains mainly 5 parts: videos, comics, games, quizzes, and a feed page, which focuses on providing HIV information to high school students. The content covered by the application includes HIV transmission, diagnostic methods, susceptible populations, prevention methods, and possible treatment. An introductory seminar will introduce the app benefits to the students and teachers. The seminar is expected to form a good learning atmosphere, and research also shows that small group education programs were highly successful at changing HIV risk behaviors. Teaching about HIV through cartoon animations, games, and comics rather than traditional textbooks is a novel and attractive way to engage students. Further, quiz scores can be compared among students to win limited edition prizes, and student engagement in social media will likely attract more people. This application is beneficial to all stakeholders, including students, teachers, schools, parents, and the government. It provides readily accessible HIV information to both students and parents, a potential teaching tool for teachers, and potential curriculum materials for schools. The proper promotion of the application among such a population will be able to reduce the HIV incidence, lowering medical costs, and thus reducing government healthcare expenditures and improving overall economy. The HIVe application prototype will be tested by a group of teachers and students, and based on their feedback, further improvements and refinements will be made. From a technical point of view, the application is both robust, thanks to a good development phase, and resilient due to continuous updates. From a social approach, the robustness and resilience is dependent on the society's acceptance, thus not robust to this problem. It can still be resilient if people are inclined to change their mind. Our education causal loop diagram indicated that the increase of HIV education will positively increase students, parents, teachers, and friends' awareness. Based on those reinforcing loops, we can see that the weight of the dots constantly increase as time goes by, which implied that such education intervention is practicable. We also conducted a questionnaire to get feedback on our intervention. The target groups were Chinese senior high school students aging from 14 to 18 years and their parents in Xi'an and Guangzhou. The questions included how this program would influence their HIV knowledge and the perceived effectiveness of our intervention. 120 questionnaires were sent out and 100 were collected. From the questionnaire, we found that respondents are very interested in our application. Majority of students and parents answered in a positive manner, scoring the app 4 out of 5, demonstrating the attractiveness and acceptability of our intervention in the Chinese population. Potential risks and barriers of this intervention include deep-rooted cultural ideas that may hinder the promotion of the application because sexual topics are still regarded as dirty talk in some areas of China. The program doesn't cover all students because it is not a compulsory program for school. Although the reinforcing loops in the education sector can prove positive results of our intervention, it is also possible to form a vicious cycle if our intervention is not implemented properly. Overall, based on our analysis, education intervention may be a tipping point to HIV. Here are our references. Thank you, and we hope you enjoyed our video.